Prenatal screening and diagnosis can help identify congenital anomalies before a baby is born. Congenital anomalies are conditions that develop in the womb and can affect a baby's development, health, and well-being. Identifying these conditions early can help parents prepare emotionally and financially for a child with special needs and can help healthcare providers plan for appropriate medical care after birth. However, prenatal screening and diagnosis is not mandatory, and it should be a personal choice for each couple. In this video, we will discuss 10 helpful pieces of information about the use of prenatal screening and diagnosis in identifying congenital anomalies. We will explore the different types of tests available, the benefits and limitations of prenatal screening and diagnosis, and the emotional impact it can have on parents. We hope this information will help you make an informed decision about whether prenatal screening and diagnosis is right for you and your family. 1. Prenatal screening and diagnosis can help identify congenital anomalies, such as Down syndrome, neural tube defects, and heart defects, before birth. Down syndrome is a genetic condition that can cause intellectual disability and other health problems. Neural tube defects can affect the development of the brain, spine, or spinal cord, and heart defects can affect the structure and function of the heart. Other congenital anomalies that can be detected through prenatal screening and diagnosis include chromosomal abnormalities, such as trisomy 18 and trisomy 13, and genetic disorders, such as cystic fibrosis and sickle cell disease. Early identification of these conditions can help parents prepare for the care their child may need after birth. 2. Prenatal screening tests include ultrasound, blood tests, and non-invasive prenatal testing, NIPT. Ultrasound is a common screening test that uses sound waves to create images of the developing fetus. It can help detect structural abnormalities and measure the size and growth of the fetus. Blood tests are another type of screening test that can measure levels of certain substances in the mother's blood that may indicate a potential problem with the fetus. Non-invasive prenatal testing, NIPT, is a newer type of screening test that uses a sample of the mother's blood to look for DNA from the fetus. This test can identify chromosomal abnormalities and genetic disorders with a high degree of accuracy. However, it's important to note that screening tests can only indicate the likelihood of a problem and cannot provide a definitive diagnosis. If a screening test indicates a potential problem, a diagnostic test, such as amniocentesis or chorionic villus sampling, CVS, may be recommended to confirm the diagnosis. 3. Prenatal diagnostic tests, such as amniocentesis and chorionic villus sampling, CVS, can confirm a suspected congenital anomaly. These tests involve taking a small sample of the amniotic fluid or placenta, respectively, and analyzing the fetal cells for genetic abnormalities, chromosomal disorders, and other congenital anomalies. These tests can help provide more detailed information about the nature and severity of the anomaly and help healthcare providers plan for appropriate medical care after birth. However, it's important to note that these tests carry a small risk of miscarriage and should only be performed if there is a high risk of a congenital anomaly or if a screening test has indicated a potential problem. Your healthcare provider can help you weigh the risks and benefits of these tests and determine if they are appropriate for you. 4. Prenatal screening and diagnosis can help parents prepare emotionally and financially for a child with a congenital anomaly. Prenatal screening and diagnosis can provide parents with valuable information about their baby's health and help them prepare emotionally and financially for the care their child may need. If a congenital anomaly is detected, parents can work with healthcare providers to develop a care plan and explore treatment options that may improve their child's quality of life. They can also connect with support groups and other families who have children with similar conditions to help them cope with the emotional challenges of raising a child with special needs. Additionally, parents may be able to access resources and services that can help with the financial costs of caring for a child with a congenital anomaly, such as insurance coverage, government programs, and community-based support organizations. It's important to note that the emotional and financial impact of raising a child with special needs can be significant, and parents should seek out the support they need to navigate this journey. 5. Early identification of a congenital anomaly can help healthcare providers plan for appropriate medical care after birth. Knowing about a potential congenital anomaly before birth can give healthcare providers time to prepare for the delivery and coordinate with specialists who can provide additional care or treatment after birth. It can also help parents prepare for the care their child may need, including surgeries, medications, therapies, and other interventions. For some conditions, such as neural tube defects, early intervention is critical to prevent further damage and improve outcomes. In other cases, such as heart defects, early detection and treatment can help reduce the risk of complications and improve the chances of a successful outcome. By working together, parents and healthcare providers can develop a care plan that meets the unique needs of the child and helps them achieve the best possible outcomes. 6. Prenatal screening and diagnosis can also help identify conditions that may require in utero intervention, such as fetal surgery. Fetal surgery is a specialized type of surgery that is performed on a developing fetus while still in the womb. It is used to correct certain congenital anomalies, such as spina bifida, congenital diaphragmatic hernia, and twin-to-twin transfusion syndrome. Detecting these conditions early through prenatal screening and diagnosis can give healthcare providers time to evaluate whether fetal surgery is a viable option and coordinate with specialists who can perform the procedure. Fetal surgery is a complex and high-risk procedure, but in some cases, it can improve outcomes and reduce the need for additional surgeries or interventions after birth. It's important to note that not all congenital anomalies require in utero intervention, and the decision to pursue fetal surgery should be carefully considered based on the specific condition and the risks and benefits of the procedure. Your healthcare provider can help you understand your options and make an informed decision. 7. Prenatal screening and diagnosis is not mandatory and should be a personal choice for each couple. While prenatal screening and diagnosis can provide valuable information about a baby's health, it's important to remember that the decision to undergo these tests should be made by the parents, based on their individual values and beliefs. Some parents may choose to undergo prenatal screening and diagnosis to prepare emotionally and financially for a child with a congenital anomaly, while others may prefer not to know in advance and instead focus on providing the best possible care for their child after birth. Additionally, some parents may decline prenatal screening and diagnosis for personal or religious reasons. Whatever your decision may be, it's important to discuss your options with your healthcare provider and make an informed choice that is right for you and your family. 8. Prenatal screening and diagnosis is not always accurate and can result in false positives or false negatives. A false positive result occurs when a test indicates a possible congenital anomaly that is not actually present, while a false negative result occurs when a test fails to detect a congenital anomaly that is actually present. False positives can cause unnecessary anxiety and lead to further testing or interventions that may not be needed, while false negatives can lead to missed opportunities for early intervention or treatment. It's important to note that no test is perfect, and all prenatal screening and diagnostic tests have limitations and potential for error. However, the accuracy of these tests can be improved by choosing the right test for your individual circumstances and working with a qualified healthcare provider who can help you interpret the results and make informed decisions about your care. 9. Prenatal screening and diagnosis can lead to anxiety and emotional distress for some parents, especially if there is a positive result. It's normal for parents to experience a range of emotions in response to this news, including shock, grief, guilt, and uncertainty about the future. It's important for healthcare providers to provide emotional support and counseling to parents who receive positive results and help them navigate the decisions they will need to make about their care and their baby's care. This may involve connecting parents with support groups, mental health professionals, or other resources that can help them cope with the stress and uncertainty of a potential congenital anomaly. It's also important for healthcare providers to provide clear and accurate information about the potential outcomes and treatment options for each condition, so parents can make informed decisions about their care. While prenatal screening and diagnosis can be a difficult and emotional process, many parents find that it provides valuable information that helps them prepare for their baby's arrival and develop a care plan that meets their unique needs. 10. It is important for healthcare providers to provide comprehensive counseling before and after prenatal screening and diagnosis to help parents make informed decisions and understand the implications of the results. Prenatal screening and diagnosis can be a complex and emotionally challenging process, and it's important for healthcare providers to provide clear and accurate information about the benefits, risks, and limitations of each test. This includes explaining the accuracy and potential for false positives and false negatives, as well as discussing the potential outcomes and treatment options for each condition that may be detected. Healthcare providers should also provide emotional support and counseling to parents who receive positive results and help them navigate the decisions they will need to make about their care and their baby's care. Additionally, healthcare providers should respect the autonomy and individual values of each parent and help them make the best decision for their unique circumstances. By providing comprehensive counseling and support, healthcare providers can help parents feel more empowered and prepared to make informed decisions about their care and their baby's care. In conclusion, prenatal screening and diagnosis can be a helpful tool for identifying congenital anomalies before birth. It can provide parents with valuable information to prepare for their child's needs and allow healthcare providers to plan for appropriate care. However, it's important to keep in mind that screening and diagnostic tests are not always accurate and can cause emotional distress for some parents. It's essential to have comprehensive counseling before and after these tests to help make informed decisions and understand the implications of the results. Ultimately, the decision to undergo prenatal screening and diagnosis should be a personal choice, and we hope that this video has provided you with the information you need to make that choice. Thank you for watching, and please remember to consult with your healthcare provider if you have any concerns or questions.